The operating theatre is a place of healing, where lives are saved and hope is restored every single day. But it also presents risks that are often invisible to the naked eye. One such risk is infection, a constant threat lurking in even the most sterile environments. Surgical site infections, or SSIs, are a serious complication that can arise after any operation, no matter how routine or complex. They occur when harmful bacteria enter the body through incisions made during surgery, sometimes despite our best efforts. These infections are not just a minor inconvenience, they can have a profound impact on a patient's recovery. They can cause significant pain and discomfort for patients, making the healing process much more difficult. SSIs can lead to longer hospital stays, delayed recoveries, and even life-threatening complications that require urgent attention. In some cases, patients may require additional surgery to address the infection and its consequences, or experience long-term health problems that affect their quality of life for months or even years. For hospitals, SSIs place a strain on resources, stretching staff and facilities to their limits. They increase healthcare costs due to prolonged treatments, additional care, and the need for more complex interventions. Hospitals invest significant effort in preventing SSIs to ensure patient well-being and responsible resource management, constantly updating protocols and training staff. That's why infection control is paramount, forming the backbone of safe surgical practice. It's about protecting patients from harm, supporting their families, and ensuring their safe recovery every step of the way. As healthcare professionals, we have a duty to minimize infection risks at every turn, standing as silent guardians in the operating theatre. Operating department practitioners, or ODPs, are vital in the fight against infections. You are the guardians of the operating theatre, ensuring a sterile environment for every procedure. Your role goes beyond simply assisting surgeons. You are the champions of infection control. From preparing the operating room to assisting during surgery and post-operative cleanup, your actions directly impact patient safety. By adhering to strict protocols and maintaining a vigilant eye, you prevent infections before they occur. Your understanding of infection control principles is essential. You are responsible for implementing these principles in every aspect of your work. This includes everything from proper hand hygiene to ensuring the sterility of instruments and equipment. Remember, your dedication to infection control makes a real difference. By working together as a team and following best practices, we create a safe and healing environment for every patient. Infection control relies on a multi-pronged approach, combining knowledge, vigilance, and teamwork to keep everyone safe. Think of it as a fortress with 5 strong walls, each one designed to protect patients and staff from the threat of infection. Let's explore these 5 core principles, which together form the backbone of effective infection prevention. First, hand hygiene, the first and most essential line of defense against infection. Hand hygiene is the single most effective way to prevent infection transmission, breaking the chain of infection before it can begin. Wash your hands thoroughly with soap and water for at least 20 seconds, especially before and after patient contact, after removing gloves, and after touching potentially contaminated surfaces. Alcohol-based hand rubs are a convenient alternative when soap and water are unavailable, but always ensure your hands are visibly clean before using them. Second, personal protective equipment, or PPE, shielding yourself and others from harm by creating a physical barrier. PPE acts as a barrier between you and potential sources of infection, reducing the risk of exposure to blood, body fluids, and airborne pathogens. This includes gloves, masks, gowns, and eye protection, each chosen based on the level of risk and the procedure being performed. Always wear appropriate PPE based on the procedure and potential for exposure to bodily fluids, and remember to remove it safely to avoid contamination. Third, aseptic technique, maintaining sterility at every step to prevent the introduction of harmful microorganisms. Aseptic technique involves using specific practices and procedures to maintain a sterile field during surgery, protecting both patients and staff. This includes proper handling of sterile instruments, maintaining a sterile field, minimizing movement around the operating table, and being mindful of what is touched. Fourth, environmental cleaning, eliminating hidden threats that can linger on surfaces and equipment. Thorough cleaning and disinfection of the operating theatre before and after each procedure are crucial to remove pathogens that could cause infection. Pay special attention to high-touch surfaces like operating tables, instrument trays, and light handles, as these are common sources of contamination. Fifth, sharps disposal, preventing needle stick injuries and the spread of bloodborne infections. Sharp instruments like needles and scalpels pose a significant infection risk if not handled and disposed of correctly. Always dispose of sharps in designated containers immediately after use, never delaying or leaving them unattended. Never recap needles or leave them lying around, as this increases the risk of accidental injury and infection. These 5 principles are the foundation of infection control, working together to create a robust defense system. By mastering them and making them part of your daily routine, you create a safer environment for patients, your colleagues, and yourselves, ensuring the best possible outcomes for everyone involved. As an ODP, your daily tasks are, honestly, absolutely critical in upholding infection control standards. Every action you take, no matter how small it may seem, plays a vital role in protecting both patients and staff from the risk of infection. First up, you are responsible for ensuring all surgical instruments are sterilized correctly. This is the foundation of safe surgery, and it's your attention to detail that makes all the difference. This means inspecting instruments for cleanliness, packaging them properly, and operating autoclaves effectively. You must be meticulous, as even a tiny oversight can have serious consequences for patient safety. Next, you need to constantly observe for potential breaches in sterility. Vigilance is key. Your sharp eyes help catch issues before they become problems. That includes making sure doors remain closed during procedures, monitoring air pressure, and, addressing any spills or contamination immediately. Quick action here can prevent the spread of harmful microorganisms. Assisting surgeons and the surgical team with gowning and gloving is also crucial. You help set the standard for aseptic technique in the operating room. You want to ensure they follow proper procedures to maintain sterility and minimize contamination risks. Your guidance and reminders help everyone stay on track. After each procedure, it's important to thoroughly clean and disinfect all surfaces and equipment. This step is essential for preparing the room for the next patient and preventing cross-contamination. This includes the operating table, instrument trays, and any areas that may have come into contact with bodily fluids. No surface should be overlooked, as thoroughness is key. And don't forget, you need to maintain accurate records of sterilization procedures, cleaning logs, and any incidents that may compromise sterility. These records are not just paperwork, they're a crucial part of patient safety. This documentation is vital for tracking potential infections and improving protocols. It helps the whole team learn from past experiences and continuously raise standards. By performing these tasks diligently, you really do become an indispensable part of the infection control team. Your expertise and commitment help create a safer environment for everyone in the hospital. Even with the best intentions, mistakes can happen. Here are some frequent errors to avoid. Taking shortcuts with hand washing is, honestly, a recipe for disaster. Always follow the recommended 20-second rule and pay attention to all hand surfaces. Don't assume that wearing gloves replaces the need for hand hygiene. Change gloves between tasks and wash your hands after removing them. Respect the designated sterile field around the operating table. Avoid reaching across it unnecessarily or allowing non-sterile items to touch it. Never reuse single-use instruments or equipment. This compromises sterility and increases infection risks, plain and simple. And remember, infection control is a team effort. Communicate any concerns or potential breaches in sterility to the surgical team immediately. By being aware of these common mistakes, you can avoid them and maintain a high standard of infection control. Infection control is not just a set of rules, it's really a mindset. It requires vigilance, attention to detail, and a commitment to patient well-being. By incorporating these principles into your daily practice, you become a champion of safety in the operating theatre. Hand hygiene is non-negotiable, so make it a habit, not an afterthought. PPE is your armour. Wear it correctly and consistently. Sterility is key, so maintain a sterile field and handle instruments with care. Cleanliness is next to godliness, so thoroughly clean and disinfect your workspace. And don't hesitate to speak up, voice concerns, or report potential breaches. Remember, every action, no matter how small, contributes to a safer environment. By working together and remaining vigilant, we can minimize infection risks and ensure the best possible outcomes for our patients.